Hello and welcome to Medical Dialogue Journal Club, your daily dose of health and medical news. I am Dr. BP Rahul and I am going to talk about a trial that finds vitamin D does not prevent type 2 diabetes in high-risk adults. A trial from Japan published by the BMJ finds that daily vitamin D supplements do not seem to prevent the development of type 2 diabetes in people who are already at high risk. The result of the trial showed that supplement had no clinically meaningful effect in high-risk adults, but suggests there may be a benefit for people with insufficient insulin secretion, although this finding remains unclear. Type 2 diabetes affects around 480 million people worldwide and is predicted to increase to 700 million by 2045. Another 500 million people have impaired glucose tolerance or prediabetes. Weight loss and exercise can lower the risk of progression to type 2 diabetes but are difficult to sustain, so new strategies are needed to tackle the problem. To address this knowledge gap, researchers therefore set out to assess whether LD-calcitol could reduce the risk of developing type 2 diabetes among people with impaired glucose tolerance. Participants of the trial were randomly assigned to receive either a standard daily dose of LD-calcitol or placebo and were assessed for diabetes every 3 months over a 3-year follow-up period. During this period, the researchers found no meaningful differences between groups in those who developed diabetes, that is 12.5% in the LD-calcitol group and 14% in placebo group, or whose blood sugar levels returned to normal, that is 23% in LD-calcitol group and 20% in placebo group. They did, however, find a significant increase in both lower back and hip bone mineral densities among those taking LD-calcitol compared with placebo. No significant difference in serious adverse event was seen between the two groups. As such, they say, although treatment with LD-calcitol did not significantly reduce the incidence of diabetes among people with prediabetes, the results suggested that the potential for a benefit effect of LD-calcitol on people with insufficient insulin secretion. And they call for further research to determine whether vitamin D is beneficial to the people with prediabetes. Until further data are available from high-quality randomized trials, researchers suggest healthcare professionals should continue to discuss with patients the musculoskeletal health benefits of vitamin D and support them to achieve and maintain lifestyle changes that, although challenging to sustain, are known to decrease development of type 2 diabetes. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.